I'm Andrea Serrano, Program Director at Reaching Our Sisters Everywhere, ROSE, and we are here in Tulsa, Oklahoma in the Greenwood Historic District at Block Wall Street. We are so glad to have brought our 12th annual ROSE Summit and Robe Summit here to Tulsa, Oklahoma. It is titled Health Equity Action for Lactation, honoring communities and community leaders addressing maternal, infant, and Black health and having them share about their projects at our summit. We also have the honor of being opened up by Councilwoman Vanessa Hall Hopper, who is a councilwoman for the Greenwood Historic District.
During the 1921 race massacre, a white mob attacked residents, homes, and businesses in the Black Greenwood District. I will say that I grew up here, and I didn't learn about the massacre until I was in my 30s.
We chose specifically to come to Tulsa because in conjunction with Juneteenth, mostly to highlight the concerns and issues that have been going on with African American families. So that just shows how they hide our history from us. And that's, some of the reasons why breastfeeding rates are so low among African American families, because we don't have the resources to actually find out why it's important.
Our office contracted with ROSE to establish a national program to encourage the initiation and sustainability of breastfeeding at least through the first 6 months among African American mothers, with support from their families and the community.
5 years ago, the Institute for Justice heard about this law in Georgia that was going to stop lactation consultants from working, and we right away knew we wanted to represent ROSE. On May 31st, the Georgia Supreme Court ruled that doing lactation consultant work is safe, and there's no reason for the state to step in and force people to have a certain amount of education to do a profession that's safe.
In the southern United States especially, particularly in rural communities, there is a disparate occurrence of ill health and sometimes, unfortunately, death. Black women are more likely to die, 4 times more likely to die during childbirth than white women. Black babies are 2 times as more likely to die in infancy than white babies. We have a crisis in America.
Privilege, as it relates to belonging, is not about the presence of anything. It's much more about the absence. It's the absence of concern and feeling marginalized and feeling othered when you look around the room and everybody's nipples are pink and yours are brown. I've worked at CDC for 20 years and still feel helpless to do anything to move the needle forward in many ways. So when it comes to belonging, privilege isn't about the presence of anything. It's much more about the absence.
And so when we think about generating work that is going to influence what's happening for Black breastfeeding and breastfeeding for people of color, having spaces that are led by people of color is really important. The goal is hopefully to create a Black breastfeeding policy collective. We now have these policy priorities. How do we mobilize the connections that we have to begin to move these priorities forward?
I am here to be able to share a little bit of information about HEAL, the Health Equity Action for Lactation Initiative, a breastfeeding program for African American mothers and families. We do celebrate that 75% of African American women have initiated breastfeeding. We're always going to celebrate that because that is a number that has grown over time. So this was very intentional on us prioritizing presenters from our priority regions that we're currently doing work on, are doing work in the near future.
I am so excited about this. I've gotten so many calls and so many just compliments about this group. That's one of the efforts that we push in Healthy Start. And so I was just excited to know that there was actually something to address breastfeeding.
I'm a representative in Region 6. We will be solidifying our regionally based networks. So regions 4, 6, and 7 moving to next year will be moving into kind of a more narrowly focused in our region and what do we need to do next perspective.
Tabahe da Chanele, Good afternoon, everyone. My name is Daily Lister. I am Hopi. I am from the Hopi and Navajo tribes. And there you can see the little red kind of strings that are hanging. It's called a sash belt. So here we use it in the birthing process. And then it's also used postpartumly.
When we zoom out and look at data across that whole first year, we see that more than half of pregnancy-related maternal deaths occur after delivery. And with your goal of breastfeeding till that first birthday, you all have a beautiful opportunity to be preventing maternal mortality and morbidity.
I want to share with you a little bit today about what we're doing at Morehouse School of Medicine as far as training our residents in breastfeeding medicine. This is not intuitive information. So the AAP recognized this a couple of years ago and developed a curriculum to help train pediatric physicians on what to do to support our breastfeeding families. And if it wasn't for this rotation, I would not have that resource, and our patients would not have the resource either. So thank you very much.
The Health Equity Action for Lactation Quad Regional Summit was funded in part through a contract with the U.S. Department of Health and Human Services Office on Women's Health, the W.K. Kellogg Foundation, the Community Service Council, Healthy Start here in Tulsa, Oklahoma, Maternal Health Learning and Innovation Center, Morehouse School of Medicine, National Institute for Children's Health Quality and Lactation Education Resources. The Reaching Our Sisters Everywhere and Reaching Our Brothers Everywhere team thanks all of our supporters.